Hi, this is a toy puppet theater commentary on the AIDS crisis in Africa against the backdrop of the corruption and greed of the American pharmaceutical industry. There was a court case in 1994 that illustrates the extraordinarily ruthless tactics taken by the pharmaceutical lobby to quelch South Africa from developing their own AIDS medications and saving the lives of their people. And this toy puppet theater show attempts to distill a lot of research into a few minutes. The commentary is that the AIDS crisis in Africa is actually deceptively simple, that existing medications can quickly change the entire landscape of AIDS in Africa in just a couple years, if we understand the role of capitalism, the HIV drug's mechanism of action, pharmaceutical development, and the dominance of the West. This puppet show is about the corruption that allows this genocide by denial to exist to this day, and the critical media coverage that doesn't exist, regardless of the politics of your news source. The story that hasn't been told is how unnecessary and preventable these deaths are, how preventable these deaths were, and how preventable they continue to be. The first basic, staggering fact about the AIDS tragedy in sub-Saharan Africa is that an estimated 30 to 40 million people have died in Africa over the last 40 years. This is in sharp contrast to the infection rates in the United States, where medications are utilized effectively and the spread of the disease is much more controlled. Let's start with a little history about the AIDS crisis and the history of AIDS treatment. In simplest terms, in 1984, the epicenter of the AIDS crisis was in the United States. The disease was identified and given the name AIDS. Gay activists in America, like ACT UP, had successfully pressured the pharmaceutical companies to fast-track cures. By the mid-90s, the cocktail, a combination of two antiretroviral drugs, started to extend life, and AIDS was no longer a death sentence, if you had insurance, and if you lived in America or Europe. Because the treatment cost $10,000 per year. In the U.S., once the cocktails came out, that's where the story of the AIDS crisis in America quiets down. In the U.S., we talk about the AIDS crisis as a thing of the past. But the reality is that in Africa, the disease was just getting started. The HIV/AIDS pharmaceutical cocktail, costing more than $10,000 per patient per year, is an amount totally out of reach to almost anyone in Africa. In developing nations, many people live on $1.50 per day. No matter how much global agencies in African countries argued, Pharma refused to discount the drugs, $10,000 per year or nothing. Then the pharmaceutical industry fought the creation of generic drugs. That's still the case to this day for countries that don't have socialized medicine. In Canada, a country with socialized medicine, the government negotiates the price, but Africa's population is so poor they have no bargaining power. They don't see sub-Saharan Africa as a customer, and they have plenty of other customers elsewhere. So in Africa, the disease continued to spread, and millions of people in Africa started to die. The epidemic was controlled in the U.S., but in Africa, without medications, things got worse and worse and worse. HIV drugs are extremely effective. They have 4 mechanisms of action, each of which stops the virus in novel ways. These drugs are so effective that patients can be weeks away from dying of AIDS, then start taking the medication and spring back to life. They call this the Lazarus effect. New HIV drugs work so well that a patient's viral load becomes what is called undetectable, which means the virus is untransmissible. So when the HIV virus is controlled, it stops the spread of the disease, both within the human body and human populations. The pharmaceutical lobby, Pharmaceutical Research and Manufacturers of America, is called Pharma. So when we say Pharma sued South Africa in 1998, it means the consortium of 39 big pharmaceutical companies that call themselves Pharma. Around this time, the South African government launched the Medicines and Related Substances Control Amendment Act, 1997. It stated simply that Africa had the right to make their own medicines however they could during this time of crisis. They created a law that permitted them to do what they needed to do to save the lives of millions of people. And if they broke some patent laws, so be it. How can you compare patent laws to a genocide that comes from corporate greed and neglect? In response, the pharma lobby banded together and launched an attack. They attempted to sue South Africa for breaking patent laws, stopping them from creating AIDS medicines, ones that would have prevented millions of people from needlessly dying every year. At this point in the story, you may be wondering why you've never heard about this lawsuit. Let's take a little tangent to talk about American news media and pharmaceutical companies. We believe we live in a world of fake news and real news. We believe that our news is real and the other side is fake. Regardless of the side you're on, you believe your news is the truth and the other side is corrupted. But what happens when both sides of the news have been paid off by pharma? What about the pharmaceutical industry's journalism school for the New York Times? What about the left-leaning news outlets who publish stories verbatim from the industry? What about NPR's underwriting by pharma? One example of the absence of critical news coverage is the Congressional Oversight Committee's investigation on drug pricing. Why didn't it make the news? Why didn't anyone cover it? Pharma perpetuates the following myth. They would stop innovating if they couldn't charge these outrageous prices. But only 11% of revenue goes to drug development. The rest goes to things like advertising, executive bonuses, and shareholder dividends. The media, even left-leaning media, was silent on the issue. $4 billion in annual advertising per pharmaceutical company means you control the editorial. What is a genocide? A genocide is defined as deliberately destroying a nation or group, and there is a book by Peter Nugani in the sources called Genocide by Denial. The title of the book redefines the word. In our modern world, there's a fine line between doing intentional harm and allowing tragedy to unfold while we stand by and do nothing. So here's the question, and the point on which we may disagree. This puppet show asks the radical question, at what point do things become so desperate that you're allowed to break patent laws? At what point are you forced to admit that the pharma companies are never going to change the way they see your people? You can argue that drug companies aren't charities, and they don't have to make medicines for people who have no money. But I will ask, if for-profit drug companies don't make the medicines, then who will? There aren't really not-for-profit pharma companies out there. Drug manufacturing is an entirely capitalist enterprise. So back to our story. 39 pharma companies sued South Africa after the 1997 Medicines Agreement. In terms of global health policy, it was a PR disaster. Pharma dropped the lawsuit eventually. But the story continues from there, and it's a legal battle that continues to this day. Did some generic drugs finally make it to the African people? Yes, but not the latest and greatest drugs. Not the drugs you start taking when the first round of medication stops working. And that's what's going to happen in the next few years. Please don't let anyone tell you things are getting better. The number of deaths have decreased, but an astronomical number of people die from AIDS in Africa every year. The percent of newly infected people continues to increase all over the continent. AIDS is one of the highest causes of death in sub-Saharan Africa. In some African countries, 15% of the population is HIV positive. Today in the US, we have PrEP, a drug that prevents you from getting HIV in the first place. With the huge influence of Christian missionaries, there was again one more force keeping AIDS-preventing drugs from Africans. In a continent of 1.3 billion, only 500,000 are on PrEP. There are two powerful forces pushing against affordable HIV drugs in Africa: Christianity and Big Pharma. So as an audience, what are you supposed to do with this information? The hope is that you have a huge issue with this line graph. It is projected that HIV deaths will gradually be reduced to zero over the next 40 years. That is totally fucking unacceptable. That's 2 generations. We've seen what we can do with the production and distribution of COVID vaccines. If we rethink this and create public awareness, there is no reason we can't break the back of the virus in Africa in the next 5 years. The story of price gouging in Big Pharma is getting to be a bigger story every day. Today, we focus on their abuses in the United States for insulin prices, and you can now see that there is an even more extreme example with a greater human toll in a faraway place. But when you understand the situation in Africa, you will see how racist and classist the for-profit pharma system can really be. And we can be critical of Big Pharma and the global organizations that have let this injustice exist for decades. Thank you for watching this puppet show.